Informed consent prior to immunization. Consent for series process. Initial visit in series, example 2 months. Parent has not reviewed standard information. May 2013. Health clinic visits involve complex conversations, including informed consent, health assessments, and other health issues. There is a difference between obtaining informed consent to immunize and deciding to do the actual immunization. The health assessment and eligibility and contraindication determination are aspects of the decision to immunize using clinical judgment. These are all outside the scope of obtaining informed consent, but are included in the scenario to demonstrate an expected flow and conversation as part of the CHC visit. The purpose of this demonstration is to obtain informed consent prior to immunization when the client has not reviewed the standard information. The process for obtaining informed consent consists of 7 steps and is outlined in the BCCDC Immunization Program Manual, Chapter 2. During an immunization appointment, these steps will be completed as part of your overall appointment and may not be done in order. For the purpose of this demonstration, the following order is being used. Step 1. Determine authority.
Hi, my name's Jessica. I'm a public health nurse and I'm going to be doing your daughter's immunizations today.
I'm Nadine. I'm Annie's mom.
Okay, great.
Step 2. Assess capability. Throughout the appointment, the vaccine provider assesses the parent's capability to give consent, taking into consideration such issues as cognitive functioning, hearing, and language barriers.
Oh, it's very nice to meet you both. And how old is Annie this morning?
Annie was born on December 21st, so she's just over 2 months old.
Okay, great. Well, you've come in right on time, which is definitely what we want. So we want her to get all her shots and we want her to get them on time. Not only will it help to keep her healthy, but it helps to protect others as well.
Okay.
So I just want to know generally about Annie's health. Has she been well? Do you have any health concerns, reasons you've had to go to the doctor, to the hospital?
No, she's been very healthy. The only reason we've gone into the doctor is to have her weight checked.
Okay.
She did have a little bit of a cold a few weeks ago, but that cleared up on its own, and she's been otherwise very healthy.
Okay, great. As far as you know, she has no allergies?
No allergies yet, and
Okay.
we're just breastfeeding still, though.
Okay, and great. And you know, breastfeeding definitely has been shown to be preventative against allergies. So it's great that you're breastfeeding.
Good.
Yeah. And so for her, I know you're saying she's well and healthy, but as far as you know, no immune system disorders or deficiencies?
No, nothing that we know about.
Okay. What about in your family? Is there a history of like chronic health problems, intestinal disorders, immunodeficiencies, anything like that?
No, everyone's fairly well.
Okay.
My mom does come to babysit and she takes a blood pressure medicine, but otherwise everyone's healthy.
Okay, well, that's no concern at all. I mean, why I'm asking you these health questions, which we are going to ask you the health questions each time you come, is we just want to know that we can go ahead and give the immunizations today and there aren't any precautions or contraindications to what we should offer her.
Okay.
Step 3. Provide standard information. The vaccine provider shows the parent the health files for diphtheria, pertussis, tetanus, polio, Haemophilus influenza type B, hepatitis B, meningococcal C, pneumococcal 13, and rotavirus.
Have you seen these health files before?
The nurse gave them to me, but I haven't had a chance to read them yet.
Okay, well that's fine. So we are just going to take some time then to actually go through and review each of them. All right?
In order for the vaccine provider to assess the client's capability to provide informed consent and to confirm understanding of the standard information presented in the health files, steps 2, 3, 4, the vaccine provider reviews key points from the health files.
So let's go ahead and look at the 4 HealthLink BC files. And what they do is they actually tell us about each of the immunizations that she can have, okay? So the first one we're going to talk about is actually a 6-in-1. So it protects against 6 diseases with 1 injection. Okay? So it protects against diphtheria, tetanus, pertussis, hepatitis B, polio, and Haemophilus influenza type B.
Okay.
And I'm actually going to go through each of those diseases with you, okay? We give this as a series of 3 doses at 2, 4, and 6 months. All right? So these are provided free to you. They're approved by Health Canada. And something you might not know, but in the last 50 years, immunization has saved more Canadians than any other health measure.
Oh, wow.
Yeah. So common reactions are the soreness, redness, and swelling where the shot was given, okay? So that's going to be in the muscle on the side of her leg.
Okay.
And then some children can have a fever, be cranky, sleepy, have some extra crying, not as hungry. That is generally mild though. It only lasts 1 to 2 days.
Okay.
Now if she had pain or fever, you can give her acetaminophen, well you might know as Tylenol or Tempra, based on her weight. Okay? And that actually is all here in your health passport, okay? So it tells you what she's having today, how many she's getting, what to expect for the next visit. And then there's this section on what to do if she has a reaction, those reactions we just talked about. And then also, based on her weight, how much acetaminophen to give her, how often to give it, who to call if you have questions.
Okay, great. That's really helpful.
Yeah, great. And that's yours to take home. And because we're doing the 2-month visit today, we do need to book the 4-month visit. So also what I'm going to give you is this text reminder call. And so basically what you do is you just text to sign up to this number. You put in your baby's date of birth, and then it's just going to send you reminders about the immunization schedule.
Oh, that's great.
Yeah, also you can just text the actual date of the appointment. It sends you a reminder as well. Yeah, so that's something new that we have. So actually I'll put that there with your health passport. So something important that I need to tell you is that I need you to wait 15 minutes after the immunizations today. Are you able to do that?
Yes.
Okay, why I want you to wait is because it's extremely rare, but it is possible that anaphylaxis could happen. So what is that? It's a life-threatening allergic reaction. It's where there's swelling of the throat, tongue, or lips. It causes problems breathing, or there's hives or bumps on the body. Now, if that happened, I have epinephrine, which is adrenaline right here. I'd give that as a treatment to stop the reaction, and then we call 911.
Okay.
Now, if this happened once you got home, you started to see these symptoms, right away I'd want you to call 911, okay? But just to keep this in mind, fewer than 1 in a million people who get the vaccine will have this reaction, and again, it's very rare.
Okay.
All right? I just want you to be here if you need help, not headed home. It talks about here who should not get the vaccine, so I would not give it to you if you told me, oh, she had the vaccine before and had an allergic reaction. So let's just briefly talk about each of the diseases, okay? So diphtheria, it's a serious infection of the nose and throat. It's spread through the air, through people, someone's coughing or sneezing and you're close and you breathe it in. It can cause really severe breathing problems. And unfortunately with diphtheria, 1 out of 10 people who get diphtheria can die. Oh. The next one is tetanus, also called lockjaw. Okay. So now you might be more familiar with this, like someone stepped on a rusty nail, they got a cut, and then, oh, I had to get my tetanus shot. And that's because this germ actually lives in the soil, and when it gets into your body, the bacteria produces this toxin or poison that goes and it causes these really painful cramping and tightenings of the muscles. And tetanus, again, is very serious. It can affect the breathing muscles, and 1 in 5 people who get tetanus may die. So again, things we just want to prevent from happening. And these two, tetanus, diphtheria, as a mom, as an adult, you should be getting them every 10 years. Because you need to kind of keep boosting them. So you're going to become really familiar with these diseases as she's growing up. Pertussis, which you might also know as whooping cough, is an infection. It can cause like pneumonia, which is infection in the lungs, can cause like seizures, brain damage, and even death, unfortunately. And we really see those more serious complications in infants, which is why we want to immunize them now and protect them. It can have this really severe coughing spells where there's like a whoop sound at the end. Have you ever heard of whooping cough or heard someone who's had that cough sound?
Actually, I had whooping cough as a child. It was awful. I coughed nonstop.
Oh my goodness. You know, definitely whooping cough is something we want to prevent rather than, you know, having Annie go through that.
Yeah, I don't want to get sick.
Yeah, definitely. And you being sick with it really makes you understand the importance of it. Hepatitis B, now this is a virus that attacks the liver and we give a vaccine to protect against it. You actually probably might have had this one in grade 6?
Yeah.
You did, okay. So now you might be thinking, well, why are you giving it to my 2-month-old? That's because if children are exposed to this virus at a young age, they often carry the virus in their body their whole lives, and that can lead to liver cancer. Oh. So we want to prevent that from happening. Yeah. And it can be transferred through blood and body fluids.
Okay.
The next one is polio. So it's a disease caused by a virus, and unfortunately, some people will have no symptoms, others can have paralysis of the arms or legs, or unfortunately even death. Polio actually is spread through contact of, I'm sick with it, I have a bowel movement, someone comes in contact with that, and that's how they can get it.
Wow.
Have you ever heard of like iron lungs?
Actually, I had an aunt who nursed patients who had polio.
Oh, wow.
The iron lungs.
Oh, Well, you've actually had some direct experience with some of these diseases. That probably makes immunization against polio more important to you because you kind of have someone who can tell you firsthand what the consequences are. The last one here is Haemophilus influenza type B. Whew, long name, you can call it HIP for short. It really affects kids under 5 years of age. Okay. So it really causes serious and life-threatening infections, which includes meningitis, which means infection in the lining of the brain. So we want to prevent that from happening, or septicemia, which is basically infection in the blood. And it's spread, which a lot of these we're going to talk about next, are spread through coughing, sneezing, having that close face-to-contact. And for every 20 children who get sick, one may die. Oh. So it's just definitely so much safer to get the vaccine and prevent it from happening rather than trying to treat it. Okay. So this is the first injection that goes in her leg. Then the next two we're going to talk about are bacterias, both of them, and we would be giving them by injection as well, okay? So the pneumococcal conjugate vaccine, it protects against 13 types of this bacteria. We give it to children at 2 months and 4 months, and a booster dose at 12 months. Now, if you told me that your daughter had some chronic health problems or was receiving medical treatment for anything, then we might actually look at giving her an extra dose at 6 months. But because she's well and healthy today, she has no pre-existing health conditions, she wouldn't need that.
Okay.
All right, so it's the best way to protect against pneumococcal disease because it can be serious and unfortunately also fatal. So it's very safe. The side effects we've already talked about from the last one, so I won't repeat those ones to you. Something I didn't mention yet is reporting back any serious or unexpected reactions or side effects. So if you're seeing something in your child that we didn't talk about, you're concerned it could be related to the vaccine, I'd want you to go to your primary health care provider, and I'd want you to call me back at the health unit, okay? Okay. Just like if you have any questions when you get home, feel free to call me back. Now, if we're closed, you can always call 811 because that's HealthLink BC. They have nurses there 24 hours a day to answer your questions. Great. Yeah. So who should not get the vaccine? It would be if you said she had it and had an allergic reaction. So what's the pneumococcal infection? Again, it's another bacteria. It can cause those serious side effects like meningitis, which means infection in the brain, septicemia, which is infection in the blood. And of course it is serious because if, say, for every 30 children that get sick with an infection with pneumococcal, one will die. And you know, we just really want to prevent that from happening. And this infection can also lead to brain damage and deafness. And it's spread that same way, the coughing, sneezing, being in that close face-to-face contact with someone who's sick. Also, babies can become sick through sharing soothers, bottles, or toys used by other children. So that's another way that it could be spread from a child to child. And that's why we say when you immunize her, not only do you keep her healthy, you also keep other children healthy because if she's not sick with it, she can't spread it to other kids. So the meningococcal C conjugate vaccine, again, it's an injection in the leg, so this is the third injection. We give it at 2 months, 12 months, and 10 to 12 years of age. Obviously, grade 6, long way off. We don't need to worry about that today. It's very safe, much safer to get the vaccine than to get meningococcal infection. The common reactions and side effects are the same. The only difference that's here is a mild headache can occur in the first 24 hours. So if you're seeing a lot of fussiness and crying, I mean, you can give acetaminophen based on her weight for pain and fever. Okay. Who wouldn't get it if you told me she'd had a life-threatening allergic reaction previously? And for every 100 children who get sick, up to 15 will die. So we really want to prevent that from happening, and also complications like, again, deafness or brain damage. And it's spread in that same way. Someone sick, coughing, sneezing, close face-to-face contact. Also spit or saliva can spread it. So obviously, you know, young children, soothers, toys, anything like that. So another reason why someone asks to share your drink, you shouldn't share your straw because that can be spread through saliva. So the last one we're going to talk about is the rotavirus vaccine. So it's the oral liquid vaccine. And it would actually be the one that we would do first because when children have this vaccine, the contents of it can actually help to reduce how children feel pain. Yeah, another thing that you can do to help reduce any pain that Annie's feeling is actually breastfeeding before, during, and after.
Okay, so there's no problem with breastfeeding during the vaccine?
No, that's fine. So obviously we'd have to give her the rotavirus vaccine first, she'd have to swallow it, and then you could breastfeed her, and then we can go ahead and get started on the injections, all right? So what is the rotavirus vaccine? It helps protect against diarrhea and vomiting that's caused by rotavirus. We give it to children at 2 months and 4 months, and we need to give it by 8 months of age. That's when it's the most effective and protective. So coming in right at 2 months, booking and coming in for your 4-month immunizations is important. We've already talked about how we give it, and that's a liquid. What I haven't mentioned is because it is a oral vaccine and she's ingesting it, when she has her baby stools, it's really important to do good hand washing because it actually can be transmitted for 10 days after the vaccine. So it's very safe, much safer to get this vaccine than the actual infection from rotavirus. Most babies actually don't have any reactions, which is true for all the immunizations we've talked about today. But some babies after this one, they could have diarrhea, be a little cranky, maybe their tummy might hurt and they might have some gas or even an itchy rash. Okay? Something that I do want to ask you and talk to you about is something called intussusception. You've probably never heard of that.
No.
Annie's never had intussusception.
Not that I know.
She doesn't have any intestinal disorders, no immune system deficiencies.
No, Annie's been healthy so far.
Yeah, and I know you told me that, but I just want to check with you. So I'm just going to tell you what intussusception is. Intussusception is a rare condition that can happen in 1 out of 2,000 children under a year of age. So what intussusception is it's a blockage in the intestine. It is something that has to be treated in the hospital. Okay? So what it can cause is like a swollen tummy. So obviously, if this ever happened to your baby, we'd want you to go to your nearest emergency department right away. Why we're talking about this is because after the vaccine, there's a very rare risk that 1 out of 2 children in 100,000 could develop intussusception. So just in the population in general, in all kids under 1 year of age, it's 1 out of 2,000, right? But after the vaccine, the risk is 1 to 2 additional cases out of 100,000. So when we look at risk benefit, obviously the benefit in protecting against rotavirus is better, but we just want to talk with you about that, all right? Again, waiting the 15 minutes, we've already talked about that. We've also talked about reporting back to me any questions or concerns, or if you had to go to the doctor or the hospital or with questions, and also how we treat fever, right? And why wouldn't I give it today is all these questions I've asked you. If there was a weakened immune system, if your baby had intussusception or it had an intestinal problem. You said that she's had a little cold, and you know babies with mild illness like cold can definitely be immunized. But if she was having diarrhea and vomiting or serious illness, we often wouldn't give this vaccine until she recovered. But because she's well and healthy today, we can go ahead. So just quickly, what is rotavirus? We often would just call it the stomach flu. It's the most common cause of diarrhea and hospitalization for children, especially under 5. And virtually almost all children by the age of 5 will have had at least 1 episode of rotavirus, okay? So it starts out fever and vomiting and then diarrhea and stomach pain. And really it's like, so if your baby came in contact with actual disease today, it's about 1 to 3 days later that she starts to get sick. And then the diarrhea can last from 4 to 8 days. Obviously, severe and frequent diarrhea is a real risk for babies because they can get dehydrated and then have to be hospitalized. And unfortunately, if it's not treated, it can result in death as well. And we've already talked about how it's easily spread through infected stools, right? And that's why the hand washing is important. So definitely best way to protect her against this disease.
Okay.
Step 4. Confirm understanding of standard information. The vaccine provider confirms understanding by assessing nonverbal cues, client questions, and clarifying the client's reasons for silence or refusing to engage in discussion.
So, do you have any questions about these health files that we've gone over today?
It's a lot of information,
Yes.
so I think I'll take them home with me to read.
Definitely.
So she's going to get the 3 vaccines in her leg,
Yeah, exactly.
and the 1 oral vaccine. She might have a little bit of fever, soreness, and crankiness, a little bit of diarrhea.
Yeah.
And otherwise, I report anything else unusual to you.
That's exactly it. Wow, see, you got that?
And you want me to wait in the waiting room for 15 minutes?
Exactly. I mean, even though it's so rare, I still want you to be here where if you needed an emergency treatment, I could provide it.
Okay.
Step 5. Provide opportunity for questions.
So is there anything else that you want me to review with you?
No.
No? Any questions?
Step 6. Confirm consent.
So can I have your consent to provide these immunizations today?
Yes.
All right, so you're ready to get started?
Yes, I am.
All right, let's get started.
Step 7. Document consent or refusal. The vaccine provider documents that informed consent has been given or refused according to the electronic record guidelines as per health authority.